For the last 120 years, Mount Sinai has been one of the leaders in the use of science to advance medicine.
The Centers of Excellence were created with one main goal, and that is to really translate science into cures for patients with blood cancers.
Center of Excellence for Blood Cancers and Myeloid Disorders is a place where we're able to provide multidisciplinary care from every angle to each patient, which allows them to have the best possible outcomes.
Excellence to me means not only providing the best care to an individual patient, but it also means to understand these diseases at such a level that we can devise treatments that would offer cure for all patients. The Centers of Excellence is really geared to making the experience for patients with blood cancers and myeloid disorders comprehensive and coordinated from the moment they come through the door.
When an individual with one of these disorders enters our unit, they see a healthcare provider team that stays with them throughout the course of treatment.
We tailor a specific treatment to that person based on the status of their disease at a given point in time. We have treatment programs for patients with lower risk disease, with higher risk disease that's evolved into leukemia.
We have a very robust Centers of Excellence that relates to patients with myeloproliferative neoplasms. These are chronic myeloid malignancies such as essential thrombocythemia, polycythemia vera, myelofibrosis, and those patients who transform to acute myeloid leukemia.
I think the outstanding part of our Center of Excellence is the development of an integrated approach, and that involves not only the use of allogeneic stem cell transplantation for curative therapy, but also clinical trials. Our whole focus is really to develop drugs that are going to deplete these malignant stem cells and lead to cure of patients.
I conduct both clinical and laboratory research investigating the Myelodysplastic Syndrome that is predominantly represented by bone marrow failure. When I first started investigating, we had no treatments that were effective for the disease. We utilized a drug called azacitidine. Ultimately, what we showed was that this drug could effectively treat patients with the Myelodysplastic Syndrome by reprogramming their cells and improving the bone marrow function, thus reducing the risk of development of acute leukemia.
The vast majority of the patients who are considered for bone marrow transplantation have one of three conditions: leukemia, lymphoma, or multiple myeloma. Bone marrow transplantation fortunately can cure a large portion of those patients and offer them excellent quality of life. Nowadays, we can teach the patient's lymphocytes to attack their cancer. We can now develop antibodies which are able to link together malignant cells and immune cells such that the immune cells from the patient can control the cancer.
This is an exciting time to be involved in the care of these patients, a very rewarding time.
I think there is a lot of optimism in the future of patients with myeloid malignancies.
In the next 5 or 10 years, what we hope to see is that our Centers of Excellence would be the premier centers for treatment in the United States that is going to change the life of patients.